Hello, my name is Roberto Fedrigo, and today I'm really excited to be presenting on negative cast modeling for oncology, a novel technique for casting radioactive tumor models. So conventionally, within nuclear medicine, we have clinical trials in which a patient population is imaged and evaluated, but it is not always possible to implement these clinical trials due to ethical limitations, it being quite time-consuming, as well as a lack of ground truth. And so we apply phantom experiments using imaging phantoms in order to simulate patients. Now this is much more time efficient and provides a known ground truth. However, phantoms are not always realistic. For instance, the NCMO image quality phantom, shown on the right, simulates lesions by injecting fluorine-18 into plastic spheres. Now this provides a really simple filling procedure, but it does not represent the complex anatomical structures that are frequently observed in patients. So the aim of this study was to develop a template-based casting approach that we can use for nuclear medicine in order to realistically model targets such as tumors in patient images. And at the end of the day, we want to be able to deliver a realistic and inexpensive method to model heterogeneous anatomy and introduce a generalizable approach that can be used to model other types of targets and other imaging modalities. And so we developed a method called negative cast modeling for oncology, or NCMO. NCMO starts off by analyzing a patient image. For instance, in this case, we segmented a lesion and saved it as a stereolithography file. Using these files, we can bring it to a 3D printer and 3D print these contours. Next, we perform some negative casting using silicone to create cavities in the shape of our target regions. And then finally, we inject a combination of liquid plastic and our radioisotope to create the final tumor models. Here's a little schematic of how this works. So first, we start with the 3D printed object and we insert it into a container. Secondly, we partially submerge the tumor in a silicone casting agent and allow it to harden. Then we apply a mold release agent to it so that it's not very sticky. And then next, we fully submerge the tumor in this silicone casting agent and once again allow it to harden. Then, because we applied that mold release agent, we can split the mold in two and remove the tumor model. And then finally, we can inject a combination of our radioisotope and liquid plastic to create the final tumor model. And once it hardens, we can simply remove it from the mold. And so the image on the left shows a PET image of these tumor models within the ProbeIQ phantom. And on the right, it shows how we can define the ground truth. By inserting these tumors into a phantom without any background, we can obtain the true radioactivity concentration. And we can also define more complex radiomics features by performing longer duration PET scans with high resolution, for instance, by putting it into an animal scanner. And one application of NCMO is to model primary mediastinal B-cell lymphoma, or PMBCL. PMBCL classically presents with really bulky, heterogeneous tumors located in the mediastinum, as shown on the right. And FDG PET is the clinical standard for diagnosing these patients. However, disease management is particularly challenging, so there's motivation to implement quantitative metrics that can predict outcome, such as the total metabolic tumor volume or the total lesion glycolysis. However, since the ground truth is not known, we need to implement phantom studies in order to validate these metrics. And so there's a significant need to model these lymphoma tumors using NCMO. And so we analyzed some PMBCL patient scans, defined the segmentations, and 3D printed them, as you can see here. Next, we insert them into the ProbeIQ phantom and obtained PET images. The image on the left is actually a patient image, and the image on the right is a PET image obtained using NCMO phantom scans. And we found that these tumors were highly realistic due to the heterogeneous shapes and radioactivity concentrations that we could obtain. Another potential application for NCMO is for prostate cancer imaging. Metastatic prostate cancer is now being imaged using the prostate-specific membrane antigen, or PSMA PET, which results in improved detection of metastatic prostate cancer. As you can see here, a focal high-contrast lesion can be observed. In addition, salivary glands appear with high uptake in PSMA PET images. So we wanted to see whether we can create the realistic anatomical structures for PSMA PET. And we cast 3 to 16 millimeter epoxy spheres that have been infused with sodium-22, which is similar decay properties to F18, but a much longer half-life, which makes it useful for performing repeated quality control experiments. After inserting these lesions into a phantom, we compared it with a patient scan. And we found that these tumor models were highly realistic due to their small diameters and also really high uptake. And we also modeled the salivary glands using templates from patient images. Here you can see the tubarial glands, parotid, submandibular, lacrimal, and sublingual. And we insert these into a phantom and compared them with patient images. In particular, here you can see the parotid and submandibular glands. And overall, they appear to be reasonably realistic due to the heterogeneous shapes and activity concentrations that we can create. To conclude, we developed negative cast modeling for oncology and used this to evaluate lymphoma in the context of FDG PET and prostate cancer in PSMA PET. And overall, this methodology cost less than $500 US. However, I should point out that the molds are reusable, and so the cost for repeated experiments is substantially less. And overall, NCMO can be used to evaluate a variety of different targets, such as lesions in oncology, or organs, such as salivary glands. And it can also be translated to other imaging modalities, such as using a gamma emitter for SPECT or contrast agents for CT. Lastly, I would like to thank everyone involved in the project, in particular our collaborators, Yugoslav Kitanovic, Scott Young, and Nicholas Fedrigo. Thank you for listening.